My name is Dr. Kristen Higgins, and I'm a thoracic radiation oncologist at Winship Cancer Institute of Emory University. So cognitive side effects can develop when patient is getting cancer treatment. Cognitive side effects can develop from different types of chemotherapies, also immunotherapies and radiation therapy. We see cognitive side effects with radiation therapy, specifically when the brain receives radiation. We can give some medicines that can reduce the chance of that happening. For example, when we deliver whole brain radiation therapy, we will sometimes give a medicine called memantine, which is a drug that's used also in the treatment of Alzheimer's disease. It's an NMDA receptor agonist and really sort of reduces the neuroexcitation in the brain. And there have been studies that show if you give memantine during whole brain radiation, then it does reduce cognitive sequelae down the road. Also with whole brain radiation therapy, we have a new technique that reduces cognitive side effects. And what it's called is hippocampal avoidance whole brain radiation therapy. And the part of the brain that really is important in creating new memories is the hippocampus. And that anatomically is located in the temporal lobes bilaterally in your brain. And what hippocampal avoidance radiation does is it carves out the radiation dose away from the hippocampus in both temporal lobes. And that's a way to preserve memory for patients that need whole brain radiation therapy. In terms of who recognizes these side effects, I would say that patients and their family members will both recognize the side effects. After whole brain radiation therapy, patients will say that they maybe feel foggy. I noticed that word retrieval is something that patients describe often after whole brain radiation therapy. They just can't find the word that they want to say. Also, remembering things, when you're going to the store, what you need to get. Those are sort of some cognitive side effects that I see in my patients commonly. I would say that generally speaking, the side effects from radiation are recognized by both the patient and the caregivers simultaneously. But the good thing is our therapies are getting better every day. And I think that we recognize that cognitive side effects are really detrimental to patients. And we are designing more and more trials with reducing cognitive side effects as an endpoint. So more work in this field is being done.